One moment. Thank you all for joining us on this warm Tuesday evening here in Kansas City. We are so glad that you're taking time out of your day to learn something new to add to your toolbox. So I am Allison Foss, and I'm the Executive Director of the Myasthenia Gravis Association. I'm joined today by Hallie Walker. Hallie is our event coordinator at the Myasthenia Gravis Association. So the two of us are going to monitor the question and answer box. So if you have questions as we go along, put them in the Q&A and we will answer them. So just a couple other announcements I wanted to share. We do have our monthly virtual meetup coming up on Monday, July 28th from 6:30 to 7:30 p.m. Central Standard Time. And this month we have a very unique topic. We're going to be talking about how to assist your peers in a crisis. So, being in the rare disease community, we understand that a lot of people connect online or in support groups. So this is just an added tool for your toolbox to help others that might be in need. So we'll be joined by Give an Hour, which provides mental health services in the rare disease space. So that is Monday, July 28th. So you should have gotten a link to also sign up to that today. So again, with no further ado, I'm going to introduce Richard Brown. Richard and I met at a conference this spring. His booth was just down from mine, and I was learning about what the Patient Advocate Foundation could do. And I really felt like this is a great resource to share with all of you. So I invited Richard to join us today and share a little bit about the Patient Advocate Foundation. Richard, we'll let you take it away, and Hallie and I will watch for questions.
All right. Thank you, Allison. I appreciate it. Let me go ahead and get my screen up here. All right. Yeah, so like Allison said, my name is Richard Brown. I am the relationship manager here at the Patient Advocate Foundation, and that is just a fancy title that they've given me. That means I get to talk to people all day, which is great. So I've been with Patient Advocate Foundation for a little over 10 years. And basically what I do is I talk to patients, I talk to other nonprofits, I talk to your doctor's office, your pharmacy, different people that are involved in healthcare to kind of keep our pulse on patient need. So what are the needs of the patients and how can we help address them? So Patient Advocate Foundation is not a disease-specific organization. We would like to call ourselves a needs-specific organization. So we're a nonprofit, and we help patients remove any barriers or obstacles they have to care. So we were founded in 1996 by a two-time breast cancer survivor. We started in 96 with a volunteer staff of 2. Last year, we reached the 220 full-time staff mark. So we are helping patients across the country, and the need is bigger than ever. So kind of the ways that we help, I'll go over here, and then I will kind of go into them a little bit deeper. We started with free case management, so that helps patients with access and affordability issues. We have a copay program, we have some financial assistance funds. We do a lot in patient education. We have some health equity work, and then we also do some research and some policy work as well. So we're based in Virginia on the East Coast. So we have a lot of storms rolling through the area right now. So I apologize if you hear any thunder in the background. It's summer here, so it's hot and it's wet. But yeah, so everything we do is over the phone or online. So we are national in scope. We helped people in 91% of all U.S. counties last year, which we're really proud of to try to get into as many parts of the country as possible. So what we were founded on is free case management. So it's a free program that helps patients with any sort of access and affordability issues. So a lot of that is health insurance navigation. So helping patients with appeals, denials, prior authorizations, helping with Medicare, Medicaid, and disability enrollment. We do a lot of working with insurers and doctors' offices. If your doctor is prescribing something and your insurance is saying that it's not covered, our case managers will dive into the language of your plan to confirm that if it's actually supposed to be covered or not, helping understand a lot of those verbiage and those clauses and policies that are in place, making sure that you're getting the most out of your insurance. We do a lot of disability navigation, so going from able to disabled with the Medicare, Medicaid disability enrollment process. And then we do a lot of work around social needs, so food, housing, utilities, transportation, those types of things. So we like to connect patients with national, regional, local services. It could be a state program, but it could also be a hyper-regional nonprofit that's maybe providing free rides back and forth to the grocery store. So a couple of highlights that we have for our case management program, which kind of helps explain a little bit more of what we do. And the one that I'm always proud of that I like to point out is last year we were able to get patients a total of $16 million in debt relief. So that's going through medical bills, making sure that it was billed correctly, it was run through insurance correctly, talking to hospitals or doctors' offices to make sure that that debt is gone. And we're not disease specific, so we are more need specific. So you'll see that our top categories range all over the place, from cancers. We have diabetes, neuromuscular, autoimmune, vascular. So in just over 800 different diseases last year, our case managers are able to assist with kind of everything that goes on. While the disease may be different, a lot of the insurance issues, unfortunately, are the same across all diseases. So we're able to help alleviate that burden. So that can be anything from calling with you to your insurance company so that we are able to walk through those processes, to help filling out forms, talking with your doctor. I walk by our case managers a lot of the times, and it's them on the phone with insurance talking about that they've faxed something 8 times. We're still using fax machines, and trying to get documents through. And I know a lot of time that administrative burden on patients, on caregivers, on family members is outrageous, the amount of time it takes to get some of these forms filled out. So our case managers being able to do that helps alleviate some of those burden. And we're able to help in many ways. So sometimes we'll get a call for insurance, which will turn into us helping with insurance, but also being able to get a reduction in an electric bill, or helping with workplace protections, FMLA, for a family member or a caregiver, so that they're able to take off time to take a loved one to the doctor, helping coordinate rides, things like that. So that's our case management department in a nutshell. If you have any questions, please feel free to go ahead and throw them into the Q&A, and I will answer them as they come in. Don't feel like you have to hold off. So another big part that we like to do is patient education. So it's one thing for us to fill out forms and help patients, but it's another thing for us to fill kind of an educational gap. So I don't know about the high school that everybody else went to, but I was not told what a deductible was. We weren't taught what an EOB was. We weren't taught how to read medical bills. And that's, unfortunate considering how many of those things we all get. So our education department really likes to try to help make that easy. So we have a lot of different materials. Those range from short-term, little tip sheets that are easily digestible in one page. We have some long format books that go on for 60 or 70 pages. We have audio, video format, English, Spanish. We just worked with a nonprofit to get a lot of our insurance information done in American Sign Language. So those videos are slowly being rolled out on our YouTube channel in ASL. So kind of different ways that people like to learn, whether they like to read, they like to watch, they like to listen. That's kind of where we are. So just to kind of give you a little bit about the topics that we cover. So these are our top 5 from last year. And no surprise, engaging with insurers, appealing a denial. We have a sample appeal letter for a claim, which is nice. We've created a letter that all you have to do is kind of plug in your information. If you don't want our case managers to do it for you, you're able to use this template. We also have accessing care without insurance. That's, always of top of mind. And then we have our National Financial Resource Directory, which is a free online tool that we have on our website. And how that came to be is our case managers over the last 30 years have been doing this work. They've been connecting with other nonprofits, other organizations, community-based organizations, state, federal, different programs. And we housed all this information in-house that our case managers were able to access. And we realized over the years that, we needed to find a way to take our database of all of these organizations that are helping and make it available. So we created our National Financial Resource Directory. The name is a little misleading. It started off as financial, but now it includes everything from patient education to disease information, support groups, financial assistance is still included. But so any kind of needs that a patient would have. So all you have to do is fill out 5 bits of information. It's, do you have insurance, your age range, what state you reside in, your diagnosis, and then what type of assistance you need. And it'll populate a list of all organizations that we're familiar with that works in that specific category. And you can print out that list or you can email that list. That's used by a lot of social workers and in-clinic resource navigators, but it's also used by a lot of caregivers as well. So we also have a Medicare Resource Center website, and that is constantly updated to display the most recent changes to Medicare. Bear with me, I'll have a tickle in my throat. I apologize. So yes, most recent changes to Medicare. They're constantly changing. We had all the changes with the IRA that set out changes for the next several years. And then as policy goes, that is changing all the time. So we keep that as up to date as possible. I will just pause for a second in case anyone has any questions. All right, so I will.
Richard, sorry.
Yeah.
A moment. We do have one question. Do you assist with peer-to-peer reviews through insurance or any educational literature pertaining to the subject?
Yes, so our case managers, that is definitely in their scope of service that they're able to do. I have to think. We have a little over 600 different resources in the education library. I believe there to be something in there on that. But I know that our case managers do it. I'm trying to think of if we have something in the library. Each year it gets a little bit of a bigger library and I forget more and more that's in there. But yes, so that is something that we do and our case managers are happy to assist with. So I will move on to our financial support programs. So the first one is copay relief, and it's always the biggest. So we're the second oldest copay relief program in the country, and we've been doing it for a while now. We started off this program in hopes to one day close this program, that it wouldn't be needed anymore, but sadly we are still here. But it is a grants program that helps with copays, coinsurance, deductibles. And a lot of our programs also cover medical insurance premiums related to a diagnosis. So we don't just cover your big brand name medications, we'll cover your generics, your biosimilars, and any other medications that are prescribed. So we will also cover things like antivirals, antibiotics, sleep aids, appetite suppressants, anything that a doctor is prescribing for the diagnosis. And that is disease specific. So our copay program is different in our case management. So our case management program doesn't have any guidelines. We assist all patients, regardless of diagnosis, regardless of income, regardless of insurance status. But our copay program is a little bit different because it's financial assistance. So we do tend to have some extra criteria there. The main one being household income. So our program sits at about 500% of the federal poverty guideline, which is pretty high. We take into consideration the number of people in your household and also your zip code. So we know that, every state is different. The cost of living changes wildly from county to county. And we take that into consideration, which is why I don't have an exact number, but the federal poverty limit going up to 500% for a family of two is normally around 90,000. So it's pretty generous as far as that goes. And then it's diagnosis specific. So you have to have a qualifying diagnosis, and then insurance coverage. Because it is a copay program, insurance coverage is important because that's how we get to the copay. To offset that, we do include paying monthly insurance premiums in those plans now, because insurance premiums are steady on the rise. So we like to make sure that we're able to help pay for the insurance, which helps get to the treatment, which helps get to the copay, which then we can then also cover. Yeah, so kind of just a little bit more on that. Like I said, we do cover the medication, but we'll also cover office visits and administrative charges related to the medication, and then premium assistance. So a couple of details about the program is that everything we do is first come, first serve. We don't operate a waiting list because we don't feel that is first come, first serve. So our funds do come and go with funding, but as soon as they open, we start taking patients via our phones and our online portals. So we have patient, provider, pharmacy, and nonprofit portals. And what that allows is for anyone that's working with the patient to be able to apply on the patient's behalf. Our nonprofit portal is newer, and as far as we know, it's the first of its kind. So our case managers were unable to apply at other organizations on behalf of patients. And we figured if we were having this problem, everyone's having this problem. So we created a nonprofit portal that any nonprofit tax ID holding entity can create a portal and help those patients as well. So our program offers 12 months, and that's a rolling 12 months. So if you apply today and are approved today, that 12 months starts today and goes until this day next year. We also offer a 6-month look back because we understand that patients didn't hear about us until after they were diagnosed. They were given a prescription, they went to the pharmacy, and it was expensive. And that's when they found us. Or sometimes they were able to pay for the first month's supply, but then the second month's supply and the third month, these things add up. So we do offer a 6 months look back, which lets us go back and reimburse you for anything that you have paid. And then we have a 2-month grace period at the end of the year because we know sometimes bills coming through the mail or getting through insurance, they take a while. So that's something that we offer. And all of our applications are now instant decision. They can be done over the phone or online, and you will know instantly if you're approved. That way, if you're waiting to fill a medication, you don't have to wait for very long. You can apply, get approved, get your pharmacy card information, give that to your pharmacy, and get your medication right then and there. We do require diagnosis verification from the doctor, but we handle that on our end. Once your information comes through, we send that to your doctor. So again, you don't have to worry about another fax, another email, another form to get filled out, we'll take care of that. And then
Sorry, I missed a question. We do have one question. How does a nonprofit get into that portal?
yeah, so it's very easy. Our copay program operates copays.org. And you can go to copays.org and there's a section for nonprofit portals. All you have to do is click create an account and just have kind of your nonprofit's information. So, the name, the address, and your tax ID number, and you'll be able to create that portal. So the nonprofit portal is actually really cool. I feel like I don't talk about it enough, but it offers more information than our normal portals. So the nonprofit portal also gives you access to our full patient library, like our education library, which is available on our website, but we've included it in the portal so you don't have to navigate away from the portal. You also get our financial resource directory, and we're also working to get that put up for case management as well. So you'd be able to apply patients for both. And then the expenditures, we try to work in a variety of different ways because we know not everybody works the same. We do have a virtual pharmacy card that you can give to your pharmacy that they'll run that information and it'll pay for your medications instantly. But we also know that some patients prefer to pay for their medication and then get reimbursed. So we also offer the process via online portals, mailing, and faxing to send documents to us. And then we can make a payment to you by check or EFT. So the question I get, and it seems like every time I do a disease-specific organization talk, I look up on our website and the fund that we have is currently closed. It's the luck that I have that every time I do one of these talks, funding has run out. But so good news, bad news situation is we do have an MG fund. It does cover everything, including medical insurance premiums. Right now it's set to $5,000 a year. It is currently used up, but we have a get notified section on our website that you can sign up for. And the second that it's open, you will get an email letting you know, which I always recommend getting those notifications because that's the quickest way, because we never know when funding is going to come and go. But as soon as we get funding, we open it up really quick. And you want to be the first to know because it is first come, first serve.
Richard, we have one more question. How does a nonprofit get listed on your resource page?
Yeah, definitely. I will drop my email address in the chat or somewhere. And yeah, you can reach out to me directly and I can have you included. So we have a specific format that we use that will be the nonprofit name, the website, email address, phone number, whatever you prefer to list, and then kind of a blurb about the nonprofit and what information you'd like us to include. That way we're syncing search results up to programs that you actually have, because we don't want to send a patient to you for something that you're not able to assist with, because that's just frustrating for everybody. So yeah, I will drop my email in the chat here in a little bit. So we also have financial assistance funds. So these are non-medical related funding. These help with those things that we all face when getting to treatment. So if it's gas, if it's parking, if it's food, housing, you have to stay at a hotel, you need to get a train ticket, a plane ticket, you need to use Uber, you need to, pay a toll. The hospital is charging you $20 a day to park. That's where these come in. So these are also disease specific, and a lot of them we operate in partnership with other nonprofits. So, they'll cover, some of them cover rent, mortgage, utilities. We have had some in the past that cover, childcare, cleaning services, burial expenses. It runs all over the place. We've had some for natural disasters. We've had some for like pediatric formula shortages. So those are always good to look at. Again, funding comes and goes, but the criteria is relatively the same as our copay program. It is based on cost of living, and then it's disease specific. Most of these funds do not have an insurance criteria because they're not paying for anything that runs through insurance. But I do like to touch on them quickly because they do come and go based on funding and who we're currently working with. So we have some that help get to treatment, some that help get to clinical trials. There's a lot of expenses in clinical trials that aren't often covered or considered. So we do a lot of that. And then I always like to touch a little bit on kind of our health equity and community engagement work. Just some highlights from 2024. We put out a documentary around breast cancer in some hard hit areas of Chicago. We did some talks at the White House in 24. We have our podcast, which is Advocates in Action, where we talk to patient advocates and shine a light on what they're doing to assist their communities. We also do some health initiatives with some local health, public health systems around health disparities and smoking cessation. And then we also have a scholarship program, which is one of our smaller programs, but it's one of my favorites because it helps provide a scholarship to patients whose education has been derailed or held back or paused due to an illness. So it's always fun. We're able to provide some scholarships to some kids that are trying to go through college, but also fighting, an illness. It's always great. And then we do have a research arm. So just touch on it briefly. We work with some universities to do patient-centered research, and this isn't disease specific. A lot of this has to do with actual patient needs. So administrative burden, how long is it taking you to fill out paperwork, to fill out portals, to fill out the same questionnaire at all your doctors, changes to policy, so changes to Medicare. If the policy says that it's going to save people money, we do some research to see, did it actually save people money? Things like that. So more of your real life issues, not necessarily disease based, but I always like to bring it up because there's, you never know who's interested in research, and who on the call may want to be involved one day. And then we do have a policy shop in DC. So National Patient Advocate Foundation, we operate it's 4 times a year. It's policy, we call it policy consortium. We get anyone that wants to be involved, they can come on, they can talk. Patients, providers, caregivers, nonprofits, community members. It's kind of sometimes it's an open forum, sometimes it's a pre-planned discussion. It's any diagnosis, just kind of what the needs are, what patients are facing. So, what patients are facing in Kansas may be different than what they're facing in Virginia, even if they're, diagnosed with the same thing. So we do that 4 times a year. And then we use the work that goes on there and we use it to affect policy change. We also have an in-person Patient Insight Congress every 18 months. This year it's in November, it's in DC, and it's kind of your in-person policy consortium where everybody that's involved in healthcare gets together to try to voice opinions, to try to come up with strategies for increasing access to healthcare or changing policies or whatever it will be. We have different researchers involved that present posters. We have different nonprofits that do talks. We have a lot of people that get together in breakout sessions to try to fix what's broken. So that's kind of PAF in a nutshell. We do over the years we've kind of changed and grown with patient need, and we try to create a program based on what patients are calling us and asking for or what we're hearing. So as you can imagine, over the years, that kind of evolves and changes into quite a bit. So yeah, that's all, I have, without boring you with too many facts and figures. If anybody has any questions or wants me to dive deeper into something, definitely let me know.
Richard, thank you so much. That was fantastic info and a lot of good resources that I had no idea existed until we met this spring. So, do we have any other questions? Anybody else? All right, I don't think we do. So, that will conclude our session today. Thank you so much, Richard, for taking the time to join us, and we hope to see the rest of you at our next. Oh, can you put your email in the chat, Richard?
Yes, I just dropped that in there under the question about getting on the resource page. So feel free to reach out. It's under the answered section.
Okay, let me put it in the chat.
Oh, yep.
There we go.
There it is.
Can you
Yeah,
all did that
feel
go
free.
through to everybody? Oh, I think I didn't. Hold on. There we go. Okay. All right. I think that concludes it, you guys. So thank you again for all being here. We hope to see you on Monday, July 28th at our next virtual webinar. Richard, thank you again for taking time today to join us and sharing a little bit about Patient Advocate Foundation. All right. Have a
Thank you
good
for
evening.
having me.
Stay cool, everyone. Bye-bye.